Hello everyone, it's Dr. David. Today we're going to go over nursing exam questions and they will all be select all the apply. So make sure you watch so that you learn how to answer these select all the apply questions, which I know are your favorite. Now let me go over some key points for select all the apply. To answer this type of question, you need to first determine which of the answer choices provided are correct. It is super important to remember that in order for the question to be scored correctly on any exam that you take in nursing school, or any exam in general, you must select all of the answer choices that apply, not just the best response. In other words, there is no partial credit, remember that. And just as a side note, select all the apply questions by definition contain at least 2 answers from the 4 to 7 options that are given. Remember, cover up all of the answers. Read the question and make sure to understand the question and what it is asking, and take 20 to 30 seconds to review what you know. Go into our Dr. Registered Nurse playlist and look at the videos regarding test taking strategies. Uncover the first answer. Read the question. Ask yourself if this statement fulfills the need of the question being asked. Repeat these steps until you figure out the answer choice for this select all the apply. Once you have chosen at least 2 choices and are confident in your answer, you need to move on. Do not try to change your answers. This is where a lot of students make mistakes. Remember, once you have chosen at least 2 choices and are confident in your answer, move on to the next. So let's look at the first exam question. The nurse is caring for a patient diagnosed with a left-sided cerebrovascular accident, CVA, which is the same as a stroke, with dysphagia. Which of the following actions by the nurse reflects appropriate care for the client? Let's read this again. The nurse is caring for a patient diagnosed with a left-sided CVA with dysphagia. Which of the following actions by the nurse reflects appropriate care for the client? So now you should take time and think, what do I know about a stroke? If a person has a left-sided CVA, they're going to have right-sided residual. Residual means that they're going to have some type of deficiency or something's going to be lacking on the right side. Dysphagia means difficulty swallowing. So this is very important for you to know because this is going to determine the appropriate care for this patient. So what do we know about dysphagia? Well, patients that have dysphagia, which is difficulty swallowing, they need to be given foods that are smooth, that are mashed, because they're having trouble swallowing. We just said that left-sided CVA means they're going to have right-sided residual. So they're going to be having issues with the right side of their body. Now let's look at the first answer choice. The nurse cares for the patient's ability to swallow. So what you need to do with the select all the apply questions, like I said in the beginning, you want to see if it is a true or false response. So you want to phrase it in a way that you can ask yourself, what fulfills the need of the question being asked?
One of the primary assessments that a nurse has to do, a nursing student, is test the patient's ability to swallow when they're given medications, when they're about to give them food as a feed. Therefore, the nurse cares for the patient's ability to swallow is part of the nursing assessment. So we are going to keep this answer for right now. B. The nurse offers the patient scrambled eggs and mashed potatoes. So how can this food affect the patient that had a left-sided CVA with dysphagia? Dysphagia being difficulty swallowing. So patients that have this issue need to be given foods that are soft as they are at higher risk for aspiration. C. The nurse instructs the patient to place food on the right side of the mouth. Let's go back to the question. It said that the patient had a left-sided CVA with dysphagia. When someone has a left-sided stroke, they're going to have a deficiency on the right side of their body. Just like if they were to have a right-sided stroke, they would have deficiencies or residual on the left side of their body. So if we were to put food on the right side of their mouth, The patient will not be able to move the food to the back of their mouth in order to be able to swallow, and they may choke on the food. D. The nurse turns off the television. This is a very important point because stroke victims, research has shown, that get easily distracted. So when a patient is trying to eat or being fed, we need to turn off all distractions so that they can focus on eating. E. The nurse offers the patient thickened liquids with a side of chicken strips. Remember that the patient has dysphagia, difficulty swallowing, due to the left-sided stroke that they had. Therefore, they need to eat soft foods. Although we will provide the patient with thickened liquids, the side of chicken strips cannot be given because it is an item that is not easily swallowed. It has to be chewed, and the patient is having problems due to having residual from their stroke. And this chicken strip can actually cause the patient to choke and lead to aspiration. So in answering the question, which of the following actions by the nurse reflects appropriate care for the client? The choices will be A. The nurse cares for the patient's ability to swallow because you're doing an assessment. B. The nurse offers the patient scrambled eggs and mashed potatoes, as these are considered soft foods. And D. The nurse turns off the television, which eliminates a distraction that the patient can have while they are eating, and they need to concentrate on doing exactly that in order to prevent choking that can lead to aspiration. Now we do the second question. A patient has been placed on neutropenic precautions and the nurse is preparing the room. Which of the following needs to be implemented? So this question is asking you about neutropenic precautions and what is done during those times. When someone is in neutropenic precautions, it means that their neutrophil count is under 2,000 or even under 500, which is a more severe case. This patient is immunocompromised, which means that they're at risk for getting an infection. Therefore, we are protecting them from our germs. So we would have to wear our masks and gloves when tending to the patient. Also, when the patient is going outside of their room, they need to wear a mask because, again, they are susceptible to infections. So they can get any type of sickness just by our germs. So let's look at the answer choices. A. Give the patient the ordered influenza vaccine. Before a patient that is on neutropenic precautions can get any type of vaccinations, they have to consult with a healthcare provider first because this vaccine can be a live vaccine and this patient is already at high risk of infection and they are immunocompromised. So they should not be getting any live vaccines. B. Get rid of flowers. Now, why would you get rid of flowers for a patient that's on neutropenic precautions? Well, flowers can bring bacteria into the patient's room. And remember, they are at high risk of infection. So you should eliminate all of the sources that can get the patient sick. And flowers is one of them. C. Give the patient fresh fruits. A neutropenic diet is for people with weakened immune systems. This diet helps protect them from bacteria and other harmful organisms that are found in some food and drinks. If a patient gets a blood test and their neutrophil count is under 500, they would put them on a neutropenic diet. This diet consists of cooked foods. They are not allowed to have any raw fruits or vegetables. D. Have the patient wear a mask only when leaving the room. Remember that the patient is at high risk of infection. One of the things that is implemented for these patients is that the nurse or whoever is taking care of the patient or a healthcare provider or even visitors have to wear a mask in order to go into the room, to be around the patient, because we are protecting the patients from our germs because they are immunocompromised. Now, if the patient has to come out of the room, they need to wear a mask. That way they are not exposed to the germs of other people. E. Have the proper personal protective equipment, PPE, in front of the patient's room for staff to put on prior to entering the room. As we just discussed, this is super important in order to protect the patient from our germs. So we need to wear the proper PPE. So rereading the question, a patient has been placed on neutropenic precautions and the nurse is preparing the room. Which of the following needs to be implemented? Well, the answer would be B, we need to get rid of the flowers. D, we have to have the patient wear a mask when leaving the room. And E, we need to make sure that the personal protective equipment is available for staff and family members that are going to be around the patient. So out of the 5 options that you were given in this Select All That Apply question, 3 were the answers. Remember that as per the definition of what a Select All That Apply question is, you need to pick at least 2 choices from the 4 to 7 that are given. And remember that if you are confident with your answers, move on to the next question. Do not change your answers. Well, I hope that you like this Select All The Apply review. I'm going to incorporate Select All The Apply questions in all of the question series that I do. Make sure to go into the Dr. Registered Nurse playlist where you will find a lot of test-taking strategies that will prepare you for any exam you have, especially your NCLEX. Leave your comments down below. I love to read them and your feedback. Make sure to like this video and press the bell for notifications as to when we upload any new content. Also, share this video and this channel with your friends. That is how the channel has been growing, and I'm so thankful for your support. Well, I wish you a great rest of your day. Bye.